Here's the top 5 mistakes I see injectors of Botox make. Number 1, undertreating the glabella. The glabella is what we refer to as the 11s. It's the lines between your eyes that makes you look ticked off, tired, angry. It's a big, strong, dominant muscle that pulls the face down, and I see that being undertreated. That really should be totally bagged, totally weakened, kept weak for about a year and a half, maybe do it every 4 months or so, and let that muscle atrophy. You don't need to look mad. That's number 1. Top mistake number 2, over-treating the forehead, the frontalis muscle. That's your lifter muscle. So we have muscles that press our brow down, these muscles, the glabella and the crow's feet, and we have a lifter muscle. And I see this muscle getting paralyzed, which is really the muscle you want to keep intact as much as possible so your brow will lift. So we have muscles that push us down, muscles that lift us up, and nothing looks more attractive on your body when it's droopy. So this should really kind of hold off on the forehead or use a limited number of units. I don't want to hear, I can still raise my eyebrows, but if you can't raise your eyebrows, they're going south. Mistake number 3, balance, respecting the balance. We have muscles that open our eyes and lift our eyes up, make us look more attractive, more interested, more paying attention. We have muscles that make us look tired, pissed off, angry, sad. And if we don't respect those balances, we'll actually make the person maybe smooth, maybe they have no movement, but they may look less attractive because their brow is dropped. So we have depressor muscles, which we can treat with impunity. We want those muscles weakened, so our frontalis lifts us up. And when we weaken the glabella complex and the crow's feet, the eyes will open up more in a nice steady fashion. The forehead will become smoother without paralyzing it. And respecting this balance realizes that we need that lifter muscle, the frontalis muscle, to be intact to have a more attractive brow. Mistake number 4, not rechecking patients after you inject them. It takes about 2 weeks for peak effect for Botox or any of the toxins. At 2 weeks, I recheck the patient if they're new, just a new patient. We'll recheck them. I want to see how he or she responded to Botox. Did I need to add a little bit more? Could I have done a little bit different? Do I need a little tweak? And then going forward, we know the dosing, proper dosing, and the schedule for the patient. So the 2-week recheck for a new patient is critical for ideal dosing of Botox. Top mistake number 5 is the injector being told by the patient where to put the Botox and how many units to use. The patient has their own experience and they bring those to us and they've had it before. I get that. But I have a certain way that I do Botox to get an ideal outcome for that patient. I do my consult in a very specific fashion so I can figure out what the needs are of the patient and then make the final determination of how many units to use, even what type of toxin to use in some cases, and how and which areas to treat. This should be something done by the experience and the expertise of the injector. The patients really know their own experience, but they wouldn't know a different experience if they haven't had it.